Hello, everyone. Welcome to the World Congress of Cardiometabolic Medicine. And today we are privileged to have Dr. Prabhakaran with us on the RightDoctors platform. Dr. Prabhakaran is known eminently in his field from cardiac epidemiology. He worked extensively on the cardiac disease related to the air pollution. And we were very delighted to hear his talk this morning. Dr. Prabhakaran, straight to the question, I'm very intrigued to find out how does the air pollution probably can affect your cardiac health. Could you just enlighten us a bit more about this, please?
Right. Thank you for having me here. Air pollution has emerged as a major risk factor for cardiovascular diseases. In fact, the WHO has added air pollution amongst it. They used to have something called the 4x4 paradigm, in which they had diet, physical activity, alcohol, and tobacco smoking as major risk factors or risk determinants causing major diseases. To this mix, they have changed it to a 5x5 paradigm, and to this mix, they have added air pollution, and on the other side, they've added mental health in addition. So air pollution has really emerged over the last few years as an important risk factor. One of the things not so well known is majority of deaths due to air pollution is because of heart diseases and stroke, heart attacks and stroke.
Absolutely.
In fact, if you ask doctors, anybody for that matter, they would say, air pollution increases the risk of bronchial asthma, worsens bronchial asthma, increases the risk for childhood pneumonia, and things like that.
Yeah.
But nobody till now knows. Even I can tell you that many doctors also are not aware that air pollution increases the risk of heart attacks and strokes. So they're very intrigued by this fact and ask this question, how does this happen? Air pollution is measured. There are several pollutants in the air which increase the risk, but one major thing is what is called as a particulate matter, 2.5. They're 2.5 micron in size, which is very, very small. Just to give you a context, it's 1/70th of a hair follicle, so it's not visible to the naked eye. It's a very tiny particle because it's so tiny that it crosses the alveolar blood barrier and it enters the blood. Once it enters the blood, it causes endothelial damage.
I see.
It stiffens the arteries, so causing hypertension. It can directly damage some of the heart muscles, leading to arrhythmias. And especially in the face of heart failure, it can increase the risk of death. And then it gets deposited in the fat cells around the abdomen and makes them pro-inflammatory. And because of that inflammation, they can have insulin resistance, diabetes, and they're also called as endocrine disruptors.
Right.
So there are multiple ways by which air pollution can affect. And just to give you some facts and numbers, it's estimated that close to 1.27 million people die due to air pollution in India every year.
Wow.
And of these, around 0.67 million is because of what we call as ambient air pollution or outdoor air pollution. The remaining is due to indoor air pollution. Although the indoor air pollution levels are going down because of use of clean fuels for cooking, but we have not reached the level where we can say we have crossed that hurdle. So intervening to reduce air pollution by policy measures can have huge benefits. Why do I say this? Because if you just take the example of blood pressure.
Right.
And if we take air pollution levels as an example, PM 2.5 levels as an example, the WHO says the annual average PM 2.5 should be less than 5 microgram per cubic meter. The Indian air quality standards are even more liberal.
Right.
They say it should be less than 40. But what is the situation in Delhi, for example? It's on an average 100. And we have estimated, based on very robust and sophisticated machine learning models, that air pollution, for every 25 microgram per cubic meter increase in PM 2.5, blood pressure in an individual will increase by 3 to 5 millimeters. You might argue, how does it matter actually? My blood pressure is 120. From 120, it goes to 123, and I'm not hypertensive. Yes, at an individual level, it may not make much of a difference. But at a population level, it makes a huge difference. If the mean blood pressure in a population goes high, the number of people who will have hypertension becomes high.
Right.
So if we reduce the air pollution levels and bring it down to our air quality standards, the number of people living with hypertension in the city of Delhi, for example, will reduce by 15%. So that's the power of intervention at a system level, at a social determinant level. And so we really need to make urgent measures in terms of reducing air pollution. Not only does it increase blood pressure, it increases the risk for diabetes, it increases the risk of death due to heart failure, it increases the risk of stroke, and it can cause many other problems, impacting the economic growth of this country.
Yeah. Well, as you rightly mentioned, I guess the conventional learning is that, whenever you have air pollution, you think of lung damage and the airway damage. But I'm truly amazed to see your study and to see that, the air pollution itself is a determinant, the prognostic determinant for the cardiac disease. Now, do you have any kind of demographic number to suggest whether it will affect more females versus males or children more than adults, or any kind of number to watch for? I know you mentioned the demographic in general, the population is more, but do you have any subset of the population which category are more affected as opposed to others?
It's interesting that you asked me that question, because at an aggregate level, it's very difficult to say, but what we have done is we have done what are called as personal monitoring studies.
Right.
So in this, we give people a backpack, we give an air pollution monitor, we give an accelerometer, we give a GPS monitor, so that we see where people go and come. So I'm giving a case study of an auto rickshaw driver, e-rickshaw driver, and his wife.
Right.
The e-rickshaw driver goes all over the city.
Yeah.
And the wife is at home. So then what we do is we take out the filters in the monitors and measure PM 2.5 levels.
Okay.
At 24 hours, in the auto rickshaw driver, it was 47. I think that's the right number.
Yeah.
And in the woman, it was 200.
Oh, really?
Now you would say that this man is going out, in polluted atmosphere, is open. He should be having higher.
Absolutely. That's a common understanding, I suppose.
Yeah. But this woman is living in a one-room tenement.
Right.
There's no ventilation.
Right.
And she's cooking at high temperature. Indian cooking is at high temperature.
Yeah.
High temperature cooking can release, even albeit at a very short interval. But if you don't have ventilation, if you're in a windowless room, in a one-room tenement, the chances are high that your PM 2.5 levels within the room will be very high. And that's what happens to this woman. So we need more nuanced studies like this to look at these differences.
Now, I'm pleased to know that you are on board, so I don't have question to doubt. But I think one last question I would like to ask, how would you intervene to prevent this from happening,
So the intervention can happen at various levels.
Right.
First is to identify what are the sources of air pollution. We broadly now know that air pollution is caused by a few factors. One is by polluting industries,
of course,
which are there. The second is by construction activities. They're a major source, actually. In fact, we would think that metro construction is very good. It is good because in the long run, it will be good.
Of course.
But in the short run, because of the construction activities, it will be bad. Then the third area is using fossil fuels for vehicular pollution, for example. Like in Delhi, actually, diesel commercial vehicles are banned. But not in many cities. In many cities, we still have diesel or unclean fuels for flying vehicles. Then construction of highways around the road would be very useful to prevent, trucks which run on diesel coming into the city and polluting. So there are activities like this. Then there is anthropogenic activities like crop residue burning or burning of dry leaves to keep yourself warm. Many of these release. Then spontaneous fires. So intervention can happen. Regulating these activities can actually decrease. The second question that is asked is what happens to people that I said heart failure, people are very at high risk.
Yeah, absolutely.
So what do you do to them? So we are actually embarked on a large randomized controlled trial of air purifiers. Air purifiers can rapidly bring down PM 2.5 at homes. So we are looking at doing a randomized controlled trial of air purifiers versus sham purifiers in patients with heart failure. We'll get the result.
With this, I'd like to thank you very much and thank you for your valuable time. And I congratulate, continue, keep doing the good work.
Thank you.
Thanks.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.